Hello, everyone. We are live. I am excited to be here today to go live for Healthcare Inspired's new edition, Real and Remarkable. We're going to talk about authenticity today. I have a very special guest on the show. We're starting season 2 of the Healthcare Inspired podcast. We have a special announcement today to introduce that season, and I want to invite my guest on. It's Maya Turner, guys. Hi.
Hi.
How are
Hello,
you?
everybody. I'm fabulous in this new year. Just fabulous. It's a great year. It's a beautiful day, and I'm spending time with my friends. So I'm just really excited to be here today.
I am just excited because I hit off season 1 of the Healthcare Inspired podcast with yours truly.
Yes.
And I am just so excited to have you back to launch season 2.
Yes.
And I have to know, Maya, are you a podcast junkie? Do you like podcasts?
You know what? I'm starting to get into it. I really am, because I think there's a lot of information that people really can gauge in with talks and opinions, and I'm starting to get into it. So I mean, there's many out there to choose from, but so far I've really only been really biased to one, and I'm so far, it's a lot out there, but I've really only been listening to one exclusively.
Is that right? Okay. Well, we'll talk about that podcast. And I'm a podcast junkie. I've not been shy about telling my audience that and others out there. I listen to mostly true crime, and I know you work sometimes in the legal field. And
Yes.
I've talked about how much I love true crime podcasts. I like listening to the legal part, though. I mean, like, I don't
Yes.
like the sad part of crime,
Right.
but I like the justice, right? And I
Yeah.
like the doing what's right. So
Right.
that's what
Right.
we're here to talk about today. We're here to talk about what's right, what's wrong. And one of the
Mhm.
things that season 2 is going to bring is it's going to be the Healthcare Inspired podcast, but we're going to have a new kind of vibe. So most of the podcasts I listen to, you have like season 1 is like the opener, and then every season they have a new story or a new idea they bring to the
Right.
table. So season 2 is going to be new, guys. It's still going to be us. Still going to be
Right.
me bringing on my friends and the people that I love. But we're going to talk about, as today we're talking about real, remarkable authenticity in your career. We want to just cut to the chase. We want to just kind of distract ourselves, I guess, or we don't want to be distracted by all the
Right.
noise out there. And so we need to figure out what is going to make us authentic.
Right.
There's a lot of, what we call it, kind of white noise.
Yes.
There's things out there that come from us all directions, especially in the field of healthcare. So in the business of medicine, we think of all the things that we have to know each day. We have
Right.
to communicate with multiple teams.
Yes.
We get physicians talking to us and they say, I heard this at a conference, or
Uh,
like they want to build this and they want to do that. And as we talked about in season 2 and in 2024, we're going to be real. We're not going to sugarcoat it for you any longer.
mm,
Um, we don't have time. We are losing hospitals that are closing. We are losing our rural community healthcare systems left and right, and
yeah.
it's not right. And some of these systems have to be bought out by those with with a big paycheck, and
Right.
they're forced to do that, and they're forced to almost kind of conform to the way they want to do things at the
Right.
expense, of course, of the patient.
Yes. Yes.
So those are some of the things we're going to talk about in this season, about what the healthcare industry is facing and what you individually out there can do to be authentic, and to let the truth be heard.
Right.
So season 2, Healthcare Echoes. I am excited to let the name just get out there. Healthcare
Yeah.
Echoes is coming at you very, very soon, on Spotify, on Apple Podcasts, on Google Podcasts, anywhere you can get a podcast. We will have it out there for you to listen to. But let's talk about our topic today, Maya, real remarkable. What do you personally think? You've had a long career, and
Yeah.
you also work on the facility side. You work with Actis. First of all, tell us, what is Actis and what do you do for that organization?
Well, I am part of the Leadership Council, and I work in an integrated health system. So it's both professional and facility. So ACTIS is the Association of Clinical Documentation Integrity Specialists. And we are a council that really kind of feeds off of each other and really kind of setting the bar for conversations regarding clinical documentation improvement in the facility setting as well as the professional outpatient setting. And so there's a lot of conversations about what is the norm, who should be accountable, those types of things. And I think using the platform of Actis, which is really a subsidiary of HICPRO, I don't know if many people know that, but it's a platform to allow for many people to voice opinions and weigh in on what is considered standard, what is considered substandard, how and what should be done when things need to be improved, and there needs to be a meaningful conversation between those people who are failing to meet organizational standards for escalation of care, failure of documentation, deficiencies of documentation. So it really does make a difference on how and what the outcomes would be when the expectations are set high and fail to meet. And we've had many meetings, and I'm on the council, leadership council for 23-24. It's been an eye-opening experience. And one of the things that I've learned is that the problems are universal. It's not necessarily unique to a facility, but they are universal in regards to how and what people are expecting and what the failure in communication and the breakdown of that communication really is.
I think it's an important topic to talk about. And I don't know, many of you out there have seen it, but on October 5th, 2023, Actis did announce that them and their parent company, HICPRO, was acquired by HEMA.
HEMA, that's right.
Yeah.
Yeah, that's pretty hot. That's pretty hot. Yeah.
Pretty big deal, guys. So
Yes.
Maya, you're a big deal. All of y'all at Actis and HICPRO, you're a big deal. And I get to have you on my podcast.
Yay.
So it's a big deal. I'm excited. Right. This is good stuff. So we're going to get in and talk about a little bit more about HEMA later.
Yes, for sure.
Absolutely. So I think about the word authenticity. In healthcare, we think of the word authenticate, right? When a physician has to authenticate their record, sign off. This is my documentation. I saw this patient. I agree with what is documented. And so when you think about that, it's the truth of the encounter. It's what is true.
Right.
And there's a lot of fakies out there, a lot of people trying to fake, right?
Yes.
That they saw a patient.
Uh-huh.
And we think about what that does. I was listening to a podcast earlier that had nothing to do with what we do in the business of medicine, but it kind of dovetailed on that. It was a crime that happened. And this woman was so upset at this physician because of what happened. And it was a crime, what happened. And she did not want that physician's name on her baby's record, on her actual baby's record. So when she pulled records, the birth certificate says this doctor delivered my baby. She went to the links where she went to the hospital and she wanted that name removed from her record. And I was listening to this and I'm thinking, this is like someone really is going after this physician. And there was reasons why she had reasons to do that. But at the same time, I'm thinking from my standpoint, we do, like, we understand why the hospital refused to do that because he is the physician of record. We can't change what happened. Right. We can't change a legal document.
No, you cannot.
And that was just threw me for a minute that someone, and from their world, they don't understand what the medical records are. They're actually a legal document. And so that was an eye-opening thing for me that someone out there without healthcare background wanted to make that happen because of what they were going through. And it was a sad story, but at the end of the day, I thought this is a legal document. We have to protect it.
Right. Yeah. I mean, I'm sorry. Not only that, but I also think that it also protects her, right? If something ever happened and they don't have a physician of record that's on that birth certificate, that signed their medical record, that shows that time of hospitalization, from a malpractice perspective, from a legal perspective, that literally protects the hospital, right? And it also protects her if something ever happened in the future with that physician about how those services were rendered. How if the record, if the physician was stricken from the record, then how would they actually prove that he was part of it if they removed his name from the record and there would not be any proof of who performed the service or any faulty doing? So yeah, and then I've been involved in cases, several, in fact, that really were involved with quality of care and what was in the record and what was proven to be in the record and authenticated by the signature. So there's a lot to say, and there's a lot of to unpack there in regards to that. So I could see why the hospital stood ground, and I could see why on every level and every legality that she was not able to do that. I could see why that happened.
Exactly. So leading into authenticity as a career, your kind of motto, I guess, I think about what we're looking at is the truth of what is
Right,
true.
right,
And there's a lot of noise out there. But what we know as coders and billers, auditors, when we work on the business side, we're trying to get things done. We're
right,
trying to get things paid. And we have to give the truth of the matter, what really took place in order to get paid. And we
right.
have to understand these regulations. Now, when I was a baby coder, when I first started out, I didn't understand all of the regulations. All I knew at that
Yes,
point in time was this is the code book. These are the guidelines. I'm going to find the code that matches documentation. That's my job,
right.
right? I pick the code. It gets out there, right? But it's not
Yeah,
getting paid
right, right.
because guess what? I didn't understand things like LCD policies. No one ever told me that, right? So
Modifier. Mm-hmm.
modifiers, yeah. So that's
Mm-hmm.
all part of coding and billing and all that. And so when I learned all that as early in my career and I was like trying to figure these things out and I was like, oh, this makes so much sense. I am doing a job, but there's more to it than just picking a code.
Right,
Um,
right, right. I call that one dimensional. You
yes,
know,
exactly.
yeah, that's one dimensional. You're not thinking about all the perspectives that involve getting paid. And there's always have to be a three perspective view of everything that's done in the physician's office, right? And the
Mhm.
integrity behind what was done and how it's submitted to be paid. So integrity behind the medical record and the three-dimensional thinking process makes a huge difference on how and what is the outcome of that claim that's being submitted.
Exactly. And we have different personalities. We have different types of people that work in an organization. They all
Mm-hmm.
have different ideas of what is wrong, right? I'm not going to go there, but we do have different personalities out there.
Yes.
Oh gosh, girl, you and I are like firecrackers. Like we want to say, we want to shout from the rooftops, but I'm just going to say it. There are administrators, there are managers
Yes.
that just don't understand how to get a claim paid.
No.
They have this attitude as it's my way or the highway. I'm in charge.
Right.
Get the charges
Creative
out
bill
today.
creative billing concepts, I call it. Yeah.
Great billing concepts. Let's just slap a modifier on there. I think that there's one.
Yeah.
It's called a 59. We can just put it on
Yeah.
there. It'll get out the door. We're good.
No.
We're solid.
No. 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 No.
No, no,
Yeah.
no, no.
Yeah. Yeah. I've seen that quite a bit, and it's interesting, especially with everybody talking about the new SDOH codes.
Mhm.
Everybody's thinking about creative ways to how to use it, and you're like, wait a minute, hold on, pump your brakes. It's not that easy. You got to follow certain requirements. It's not because of the complexity. It's got to be a chronic condition that's accompanied with that complexity. So it's there. There's a whole lot of things that have to be involved with that. And as educators, you do your best to scream to the mountaintop. But if nobody is willing to listen, you're still going to hit the bottleneck of payment, which is pretty much what nobody wants. But if you don't listen initially, that's what's going to happen.
Exactly. And, there are ways to be authentic in your career that don't obviously violate a regulation or law. And we want to kind of
Yeah.
shout from the rooftops today. I understand we live in very scary times. The pandemic happened. A lot of people lost their jobs for many reasons that weren't even fair. And so
Right.
they walked away from an organization because they just could not work there anymore because they didn't believe in what that organization was doing.
Yeah.
And there is nothing wrong with that. I have done the same in my career at times where I have walked away because I just couldn't do it. And I
Yeah.
was afraid at times, I had that fear like, okay, I'm on my own. I'm going to start over. I'm going to do this. And so you have to figure out how to make yourself authentic. And let's
Yes.
talk about, as a consultant, some of people have approached me and they have said, I want to go out on my own like you. And I want to figure out how to do this. And there's so many people out there doing it. How do I make myself authentic and real and people someone's going to go to, right? And that's what it's all about, is whether you're a
Right.
coder working in the field, whether you are a consultant, you have to stand out because there's so many others trying to do the same thing, trying to
Right.
get the job you want, right?
Right. 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 Right.
You may have the same skill set, you might have the credential that everyone
Right.
else has. How do you be authentic? And there's great ways to do that, but I also think you have to find the right organization for you, or in
Right.
general the right organization. Not every organization that offers you a job is going to be worth your time. So Maya, what do you think, what are some tips that you can give people when they're looking for a job or wanting to go out on their own? What do you want to look for to make yourself authentic?
Mhm. That's a really trick question. I actually had this conversation yesterday, so this is really um, interesting. I think one of the things that makes you stand out is being asserted in your knowledge. You can't have many different perceptions of what you think is right versus knowing it because it's been done in practice. You have to know what you're doing. Nobody wants a jack of all trades. Everybody wants the master of one, at least one, not none, but at least one, in order for you to be authentic. And I've one of the terms that I've used is when you want to be authentic, you know that topic from beginning to end and from end to beginning, with everything in between, and you can elaborate and speak on everything that's related to that. So if you're able to prove who you are as an expert in that one subject, build off of that one subject. Don't say you know how to do everything and not really know it from beginning to end like you know the one thing. Don't expect everybody to help you, like you said before. Don't expect other folks to do your job. If you don't know how to do your job, then don't say you know how to do that job, because it's not your job. That's not your realm, right? Not,
Mhm.
it's not. It's not. It won't ever be. So my thing is, if you want people to notice who you are, you want people to be cognizant of your expert and your weighted opinion, know what that one thing is, do it so well that you could do it in your sleep and explain others to do it, and they get it without an issue, period. I can't say that enough. Don't say you know how to do everything if you really don't know only how to do one thing. You could know the subject, but don't say you know how to do everything about the subject if you really don't know it and haven't done it enough.
Oh, exactly. And I am all for people definitely advancing their career and doing what's good for them and like making themselves, you know, um, more knowledgeable in the topic, which is great to do. But just getting a credential, taking a test does
Yes,
not make you an
it's
expert.
not enough.
It takes
Mm-mm.
it's not enough. And I don't mean to sound mean and like you're
No,
never going to get there. You will get there, but
you
not
will.
today.
No, no. And I always feel like if you don't put anything into it, you won't get anything out of it. Taking a test and studying for a test is not real world. You have to have the vested experience to weigh in on that certification, right? There's always a test to teach you the concepts, but when you get in real world, that test is not necessarily equivalent to what happens in real world scenarios. It does help you understand and make the application, but it's not the same. And if
Mhm.
anybody tells you that it's the same, then they're lying to you, and they probably have the same amount of experience as you do.
Oh, and it's scary thought. I've worked with people that have been in that job for 20 years and have never advanced in their knowledge, and they're stuck 20 years ago what they learned, and they've
Hmm. Hmm.
never gotten past that. So they're making mistakes left and right, not realizing things have changed. And recently
Yes.
I unfortunately I had I mean it's a good experience for the office to learn that they had someone that had left the company, and this person had control of the billing and coding for 30 years.
Mhm.
And had trained the people a certain way
Mhm.
on certain things. Now she wasn't all wrong. I
Right.
didn't have to untrain everything, but there
Right.
were various important things I had to untrain, and the girls just felt sick to their stomach. They're like, why have we been doing this way for so long? And
Oh
it
my
wasn't,
God.
I was just saying, do this because I said so. I'm like, this is in black and white, the NCCI manual, the Medicare, processing manual. I'm showing you
Mm-hmm.
from the
Hmm.
horse's mouth. This is what it says. This is what United Healthcare says is how you put a modifier 50 on the claim.
Right.
This
Right.
is, they don't want RTLT or whoever it is. I showed them the policy. Like, this
Yeah.
is how they want it.
Yeah. Yeah. Yeah.
And their
Yeah.
eyes were
Yeah.
opened.
Yeah. And I think, especially when you've been invested in our world of reimbursement, you could do something for a bazillion years, be doing it wrong, and have no idea that you're doing it wrong. And I think we're in a day and age where there's accountability behind your actions, where before maybe it wasn't as much because people weren't paying attention as much because the world of reimbursement wasn't compromised as much because of the amount of fraud that allegedly may not have been as prevalent as it is now. So when you really think about it, you know, authenticity, verification, resources, and understanding what's needed and be accountable for what you do is going to be everything about being an expert.
Mm-hmm.
Knowing what those resources are without looking at it and knowing what it says without blinking an eye and being able to show someone what exactly those resources are without it being misunderstood because it's there in black and white. Don't go by
Exactly.
what I'm saying. Look at what's here, and I'm telling you, this is what this says. So
Exactly.
yeah, we're in a day and age of accountability where
Mm-hmm.
authenticity equates accountability, and if you do not have either one of those as part of your integrity, then you're compromising who you're working for and the outcome of you keeping that payment. That's just it. That's just the bottom line.
Mm-hmm. Absolutely. And I think about compliance. We
Mm-hmm.
talk about compliance.
Yeah.
Back in the day, it was like, oh, the compliance officer's coming in. We better make sure we have our screens locked.
Mm-mm,
And
mm-mm,
but
mm-mm.
guess what? We should do it anyway. It
Yeah.
it should
Yeah.
be. It's not that we should be afraid of because it's supposed to be done. It's like
That's right.
I don't understand people. I was always did my best once I learned, you know, the compliance aspects of healthcare. What I knew, what was expected of me, I just did it because I know it was the right thing to do. Like I was protecting patient information. I was
Right.
protecting, say it was my information and some worker in the office just let everyone in the world see it. I wouldn't like that either. There's a
No.
reason these rules exist. They
Yes.
protect you, they protect
Mhm.
me, they protect our families. And we have
Absolutely.
to realize what everything we do, everything we touch is a real person.
And
And
it's a footprint.
yep.
Everything that you touch is electronic and it has a footprint. So don't think just because nobody's watching you do it doesn't mean that you're not leaving an electronic footprint. So even though nobody sees you do it, somebody can come behind you and see exactly what you did, how you did it, why you did it, and when you did it. So
Mhm.
why even put yourself at risk?
Exactly. And one of the things that we talk about, and I work with a lot of tech experts now. I work with a consultant firm that helps physicians find software. And
Yeah.
so I'm always looking at, okay, like, is this software going to help you? What
Right.
is your need?
Right.
What problem are you trying to solve?
Right.
There's this concept out there of fake it till you make it.
Oh no, no,
And,
no.
you know,
No,
it's like,
no, no,
yeah, I
no.
have the technology. We can help you. Let's sign the contract. Oh, by the way, in the background, let's find some people that can do this. I'm just like, really? Really?
No, 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 no. I think that's the quickest way to lose money because you're going to spend
Oh,
more money trying to learn how to use it than what you actually paid for it. Because it's either going to lose money in the beginning or it's going to lose money in the ending when they take it back because it was done wrong. So,
exactly. So you buy a solution, this is going to save your life, and this company says they can handle all this, but before too long, the claims they get denied, the process gets worse, and you're like a year down the line realizing how much money you've lost. So
right.
before you choose a technology, understand it.
Yes.
Before you choose an EMR system, understand it. How is
Mhm.
it going to affect the physician's workflow? How is it going to affect the coders and billers workflow, the front desk, who is like the most important job in the office
Oh yeah,
besides
we
the
talked about
physician that
that.
sees
Yeah,
that? I
absolutely.
mean, they are one of the most important jobs in the office because
If not the,
they start it.
yeah, and if not the most important, because they're the ones who are one setting the standard. They're the face of the office, and they're the pace of how that revenue is collected. If it's not done right in the beginning, it's going to be right on the back end, and it's going to create a bottleneck. And that's the last thing a starting practice who's investing in software needs when they're losing money from the beginning. When it's yeah, and I've seen it. I've seen it happen. I've seen it happen when it was done wrong.
Absolutely. And there's not everyone's going to, have the same personality. They're not going to be extroverted
Right.
or introverted. We're all different, right? Some people don't like confrontation. Some people are okay with it, like myself. I love it. I'm like, I'll tell you what's up. I know it wasn't always that way, but when I started seeing things being done wrong and the effects that it had on real
Yes.
people, I
Yeah. Yeah. Yeah.
said, enough. I
Right.
am done. I'm not going to be a part of an organization that doesn't understand how this is affecting real people.
Right. Right.
Um,
Right.
so we think about, as a consultant, you're a trusted resource for a practice. They pay you a lot of money to give them advice or lead them down a path that's going to help them and their patients. So you need to be authentic as a consultant. You need to also
Yeah.
educate yourself, make sure
Right.
that what you're telling your clients is actually accurate. So for
Yes.
instance, this year when the G22 whatever when one came out,
Yeah.
it's like, oh my goodness, this code. A lot of us had a lot of thoughts about it. And
Yeah.
you might listen to a podcast here, you might read an article here. All of them pretty much tell the same thing, but it doesn't do any good unless you can prove
Uh-huh.
to a
Yeah.
practice why
Right.
or why not they shouldn't be using this code, or they should be
Right.
using it, how they should be
Mhm.
using it, because
Mhm. Mhm.
ultimately
Mhm.
they have to make the decision,
Yes.
right, to use it.
Right.
So
Right.
there's a lot of great information out there. I trust a lot of people with what they put out there. I trust 100% Terry Fletcher,
Oh yeah.
Sean Weiss,
Yeah. Yeah. Yeah.
Doctors
Yeah.
Management, NamUs. They have accurate information because guess what? They're getting the information
Yeah.
from what is actually true. The truth
Right.
of the source, Medicare, the one who created the code,
Yes.
right?
Absolutely. 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 Yes.
So you take what they say and you know that it's coming from Medicare because you read the policy, you
Right.
read
Right.
the final rule, what they said it's going to do.
Mhm.
But you're not just going to jump right out there and start using it.
No.
You're going to understand what this code is supposed to do. You're going to understand the impact on your bottom line. Is this a
Mhm.
beneficial code? What's it going to do for me? Am I
Right.
even do I even have the scope to even report this code? Do I understand the documentation? That's just one example. And
Right.
if
Right.
you can know that, and you understand in and out why the code was created, what it's used for, what documentation is needed, make
Yeah.
yourself authentic. If someone comes to you and says, I don't know if I should use this code or not, you're going to be able to tell them
Yeah.
why,
Yeah. Yeah.
what it
Yeah.
is as a
Right.
consultant, and then
Right.
show them the backup, right?
Right. And I think one of the things that is more important is not only listening to resources and different opinions, but understanding and reading the sources that they're resourcing. Right.
Yes,
And then you should be able to understand with clarity and make it practical for your environment and you being a consultant. You know, don't get me wrong, I think everybody has resources, but are they viable resources that are applicable for you and how that practice would be able to benefit from? So you're
mhm,
as good as your resources. And it's not just listening to what someone says, it's about listening to what someone says, taking the resources that they've utilized for what they've said, reading them for yourself, have an understanding, pair it up with the opinions, and then have a practical way to approach it once you understand it from all of those opinions and reading that source document for yourself. Period. You know,
exactly,
I don't
period.
no, 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 no. You yeah, you know, and I heard no, but okay, but did you read it? Okay. Did you
No.
understand after what they said? Did you understand what they're saying in the MLN matters and how certain things don't apply? I mean, they could be talking about facility and you're professional based consultant. So
Yeah.
you have to know how it applies to you, what doesn't, and really, you know, as in the words of our friend Kim, go fish, right?
Yes, I love
Understand
it,
what?
Kim.
Yeah,
Shout out to
yeah.
Kim Joliet Williams. Love you.
Yes, yes, that's our friend, you know, and
Go
just go
fish.
fish and know exactly what it pertains to you and how it is going to be beneficial for whoever it is that you're consulting for.
Yep. I'll just shout it out. Awesome sauce. Another thing that she says a lot. Yes, awesome sauce right there. I love it.
Yes, yes.
Um, well, 2004 was
Hmm.
20 years ago. That was the year
Wow.
I got married, actually. So, guess what, guys? I'm celebrating my 20-year marriage to my amazing husband this year. Yay. And
Yay.
I always like, I've been so excited that for this year to come because I have decided to call it the year of my anniversary. So, literally every month we're doing something for each other, like presents or like going somewhere. And we're going to New York City for our anniversary in June.
Oh,
So,
excuse me.
yeah, I'm going to party in NYC, but I'm excited for this year for many reasons. But I
Yes,
thought back, like, what else happened in 2004? Guess what? That was the year that, regardless of who agrees who started it, Facebook came on the scene. It was
it does.
created.
Yeah,
Social media 20
yeah.
years ago, this thing we call
Wow.
Facebook started this rabbit hole down all these social media platforms that we see now, and society has changed
It has
since
changed
social
tremendously
media came on the
then.
scene. And you can say whatever you want on social media and people almost always believe it. Just like, oh, but I saw it on Facebook, I
Yeah.
saw it on Instagram, and you follow the
You're
link
like,
and you're like, this is not correct. What are they talking
no. Yeah, yeah, I've seen that too. And I've also seen a lot of conspiracy theory that is related to um the world of healthcare and Medicare and federal and
about?
state. And it's just it's as good as the source. And if they can't quote a source behind what they're doing, then it's not believable for you to execute, to accept what they're saying. And so people are so quick to believe something without being resourceful, that becomes the danger behind
Mhm.
it. Because before, the information that we had was as good as the encyclopedia set that your mom bought.
Yeah, exactly.
So it's not the information is as good as the source and how you can resource the facts based upon that source. So, you
Right.
know, I, yeah, and I'll just leave it there because um that seems to be a lot of the Gen Y and Gen what Gen Z is it?
Gen
I don't
Z,
know.
yeah. I know, right?
How yeah, I'm just
Yeah,
saying.
I'm a front end millennial, so I don't know. I mean, like, I don't associate myself with some of the stereotypes of some,
Yeah,
but I
of
was
some.
born in 1982, so I mean, I'm at the beginning of that. But
I was born
generationally, it
in
doesn't matter what
72.
generation, doesn't matter what generation you're in. Just do what's right. Don't
Right,
complain. Don't be a
right, right,
complainer. It doesn't solve
right.
anything. But that's what we're seeing out there. We're seeing a lot of complaints, and there was one complaint recently that I want to address, and I think that you and I are a good fit to address this, especially since you are part of an organization that has been acquired by AHEMA,
Right.
because there have been a lot of complaints lately about the update that AHEMA has made to the CEO arrangement starting in 2025. And
Yes.
yes, we have a whole year, guys, to get our stuff together and figure
Hmm.
this out.
Hmm.
When you signed up to be a medical coder, when you heard about medical coding for the first time, you might have been misled. A lot of people were misled to thinking what this career was, what it would entail. I can just walk into a career. I can be a
Yes.
coder tomorrow. I'll get
Yeah.
certified. I'm going to make all this money. I can work from home. All of the different stereotypes are out there. Doesn't mean it's not a worthwhile career. Anything worth doing is going to take work. It's going to take money. It's going to
You
take
have to trust the
education.
process. Yes. Yes.
Trust the process. There's lots of jobs out there. If you just want a job, that's fine. You can go work at Walmart if you want, work at
Yeah.
Target. That's, I
Yeah.
mean, Starbucks pays you like really well. You can make a
Yes,
good money at
they
Starbucks.
do.
Chick-fil-A, you can make a ton of money at Chick-fil-A. Telling you what. But it doesn't mean it's going to be a career you want, but it's just a job,
Exactly.
right? It's going to
Right.
satisfy your need to provide for your family. So
Yes.
it costs money. These organizations that exist, they are, for instance, AHEMA is an accredited organization.
Yeah.
They are a trusted organization.
Hmm.
Now, they are run and everyone a part of the organization, they're not perfect, guys. Do you know one person that walks on this earth today that is perfect 100% of the time?
Not
No,
today. Some
not
time
today.
ago.
Long
Right.
time ago,
But
like
some
2,000
time
years
ago
ago.
they walked on water. So
Yeah, I know, right? But today, as Christine Hall says, we want to respect this arrangement. We
yeah.
may not respect how it's going to affect us, right? We're like, this
Right.
is going to really hurt my budget, right?
Right.
But think
No.
about it. They have
Yeah.
offered so many opportunities. They're only asking for 40%
Yes.
of your CE requirement. Only
Yeah.
40% has to come from them.
Right.
And in our show notes, and I'm going to share also with the team, with my team, and also on LinkedIn here, I want to share Fami Lockwood because she wrote an article on this, and
I
I love
saw
her.
that. Yeah.
And she did the math, guys. It's in black and white, easy to follow. And first of all, being a professional means that we respect the organizations that have
Absolutely.
provided that professional credential for us. We may
Hmm.
not like every individual at those organizations. We may not always like the updates, but we're in a system now where inflation is real.
Yeah.
I've had to increase my prices and for my consultant fees because it's just reality. I
Right.
went to remember back when we had eggs like $5 a carton or more. I didn't want to
Yeah.
buy them. I didn't buy eggs for
Yeah.
months.
Yeah. 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 Yeah.
I went to where did I go? I went to Chick-fil-A the other day for lunch. And I remember like several years ago, I could buy like a meal for $7. It was $14.
Yeah.
And I was like,
Hmm.
what? So I'm like, it's real, guys.
Yeah.
Everyone's feeling it. We
Yeah.
have to know it's this is the way, this is the society we live in. So,
Right.
but there's also things like, looking at their membership, for instance, they
Yeah.
offer what? A premium membership
Yeah.
that comes with all kinds of good stuff in it. So
Right.
you can do yourself a lot of good and really satisfy a lot of that with the premium membership.
Right. And I
If you look at
think,
the
no, I was just gonna say, and I hate to like, but you and I, we are cut of the same cloth, and I have to say that if you took the time to study for a test, to be a part of an organization that has a standard, right? Then you, as a coder, as being part of that organization, should know that you should invest in the organization that you're a part of because that's the reason why you became a part of it. Period. And so when there are requirements that have to be met that that you question, but think about the integrity of that organization. And if they didn't meet up to uh, today's economic scope, right? And think about how much you have to spend for X amount of dollars. They have to make money too to keep up with the integrity and the quality of the membership for their organization. So when you think about it from that perspective, it almost makes sense, right? For
Mhm.
you to understand that this is their adjustment for today's times and to be the type of organization that you would expect them to be and the resources that you expect for them to provide in order for them to be who they are and why you joined that organization and from the beginning. So
Mhm.
it makes sense for them to make those types of adjustments and it's not the end of the world. You still are going to go to Jewel or whatever grocery store that's by you to buy those eggs because you need to make a cake. You're still going to go to the store to get those meats, even though those meats may have gone up in price, but because you need to eat. It's the same concept. So,
Mhm.
as long as you realize that these are adjustments that everybody is making, then you should in turn
Mhm.
make the same adjustment and still be a part of it because that is today's times. This is today's economic scope. And because of that, it shouldn't be an issue. I mean, that's just my opinion.
And mine too. But what I going back to being authentic and looking at the actual source, a lot of people are putting out things on social media and everyone's commenting and they get all in the drama phase. They're like, oh, drama queens out there. And you're typing all this stuff in and you're listening to people saying you don't actually know if it's true. And so
Right.
you got to go to the source, go to a HEMA's website, read
Yes.
what they're telling you, and you'll find they
Absolutely.
also have said that they are going to also update some of their policies. They're going
Right.
to update the quality of their presentations. They haven't updated, or maybe, a lot of organizations, they look at things over time. And so in the last 10 years, things haven't really changed much. So they took a really hard look at their policies and some of the quality of their presentations that are out there. And they said they're going to make adjustments. So it's not
Right.
just the adjustment in the requirement, it's adjustment in their policy, it's adjustment in the way that they present information to the public.
And that makes sense, and that goes back to what I just stated. When you think about packaging, that's the same I mean, if you could look at a package and see that it's the same from today to 10 years ago, then they probably are getting ready to make some changes too. Think about products, think about marketability, think about viability. That's the most important. Viability behind the information. If you're a part of an organization, you want the information that you get from it to be, number one, viable, and two, representative of the scope of the services that you're providing for either A, an organization, or B, as a consultant. If you're part of that, then it should in turn represent everything that entails that is relevant to today's times and authenticated by its integrity of the work that's put behind it from the people who do the work. So you have to account for all of that. Somebody's got to be paid. Somebody's got to research it. Somebody's got to put it out there and make it available so that it's one, true, and B, available for everyone who's going to use it. And sourceful as a point of or a sourceful as a resource for people to utilize when they're using that as part of their research, or part of a document, or part of a teaching aid. All of those things make a difference, and somebody's got to get paid, somebody's got to do the work. So all of this that's related to cost and change, and I mean, all of that makes sense from people who know that they're going to utilize it to that extent.
Exactly. And, I want to close out today with just reminding everyone that you're only as authentic as what you put out there, and
Uh-huh.
authenticity matters. Now, to
Yeah.
some people, it doesn't matter. They're still going to try to get around the system, and they're still going to
Mhm.
try to get around the rules. But if you want to survive and go into the next phase where we see AI taking on, and you don't want to be afraid, don't listen to the noise out there saying that's going to replace your job.
Yeah.
And if you're afraid of that, then think what your next step is. Think about where you can go next in your career, because coding is not, and billing is not all there is to do in healthcare.
No,
You
it's
might have been
not.
doing that your whole for 20 years, and you're like, I don't want to change. That's fine. But if you really truly want to climb and you want to go places, and you want to be that voice, then think about what you can do to learn more about this technology. How can you make yourself relevant,
Mhm,
make
mhm,
yourself
mhm.
authentic, that when you go out on social media, or you have a voice somewhere, you talk to someone, they know this is a person that really knows what they're talking about. They're an
Yeah, yeah,
expert.
yeah,
And
yeah,
so
yeah.
be that person.
Right.
And Maya, thank you for coming on the show today. It's always a pleasure.
Yes, ma'am. And it's just one thing. Don't be in a coding bunker. Don't put yourself in a bunker.
Yes.
And I love being on these shows. I mean, this is my favorite podcast.
Oh, really?
And I
Good
just
to
think
know.
that it's always something to voice and hear the voices of others, but it's also one to create your own voice by being resourceful for the things that are heard, that are said, and referenced so that you can be an expert. And being authenticated in your field requires just that.
Exactly. And coming up on future shows, we're going to be talking about different ways that we can show authenticity, and that we can kind of get around the echoes we hear in healthcare. So again, Healthcare Echoes is coming at you, season 2. We're going to be covering lots of topics, and the goal is to realize that the echoes around us, we have to kind of get around them. We have to get around what is echoing around us and get to the truth, get to the bottom line, what's really true.
Absolutely.
There's a lot of information out there, what we should or should not do. So we're going to be talking about the risk involved in doing certain things, such as creative billing, as mentioned earlier by Maya. We actually have an episode coming up on creative billing. We're going to talk about some of the recent updates to a lot of facility type things that, Maya is an expert in. So I don't often talk about the facility side. I do work with facilities, but sometimes I stick more to the prophy side. So we're gonna bring
Right.
Maya back, and we're gonna talk about some facility stuff for all you facility coders and billers, auditors, and administrators. So stay tuned for that. And let's just try to be authentic. Let's try to be those people that you would go to for the truth.
Right.
You and I, Maya, we love movies. We love legal
Yes.
movies. So I'm gonna say something to you right now. I want to see how you respond.
Okay.
Maya, I want the truth. Come on, you
That
know what it is.
is a
You
few
can't
good men.
handle the truth. What is it?
A few good men. Jack Nicholson
Yes.
on the stand. Yes.
Yes. Okay. So that's what I'll leave y'all with. You want the truth? You think you can't handle the truth? Well, we need the truth. We need to get around this red tape and whatever people are trying to put at us that they say is truth. Get to the bottom line. Don't suffer and risk your organization's reputation by ignoring the truth. So
Absolutely. The truth
I'm
is
going to leave
everything.
you. Truth is everything. So thank you everyone for joining today. We look forward to bringing you more from the Healthcare Echoes season 2. So stay tuned for that and have a good one, guys.